So I'm going to talk to you a bit, I think, a theme that obviously has been widely discussed and will continue to be about the future, but it's a very specific future because it's my future and your future and the future of your family. That's what the whole personalized medicine, personalized health space is all about. And I have a little crystal ball here because part of what we're talking about is both what are the trends, where are we heading with this thing called personalized health, and also, of course, it's about predicting things about you potentially that might happen in the future. Personalized, predictive, preventive, participatory. And all four of these are very important to what this personalized health revolution, if you will, is all about. So number one, technology is closer than we think. During the Human Genome Project, it cost $3 billion to do one genome. We're now down to maybe under $5,000 and heading very quickly towards what they call the $1,000 genome. But the big trend here is that according to Price Waterhouse, in 2015, we're going to be upwards of $450 billion in this market. And it's moving at a very, very fast clip. So that gives you some economics of this. Number two, in the gaps and barriers. A big important part of this is that this science still needs validating. When you study science and technology, you know that oftentimes the discoveries, the preliminary discoveries, move so fast that you still need to take time to validate them. And in fact, as I mentioned, full genomic testing, getting every nucleotide tested, is actually really easy right now, and it's getting incredibly cheap. But nobody still really knows what that means. You know, to have 3 billion base pairs sequenced, which I've had done, you know, it's a lot of work to make sense of all of that data. You need new business models. I mean, right now, most healthcare is still centered on hospitals, you know, big physical plants, physicians, and we are shifting slowly but surely into much more online, internet-based, and personal-based. So number three is this challenge to link science and wellness. But you know, looking for those big trends, this is one that's been coming for a long time but this is a $4 billion market right now, $400 billion. And it's growing even more rapidly than the wider, you know, than the personalized health movement. And isn't it interesting to envision this linking up with science? So just to sum that up, you've got the P4 science and all this clinical data being collected in the various ways. You've got the wellness movement, and you've got basically this focus now on we don't have a good name for it, but the consumer/patient. I wish we could come up, because it's not really a consumer and not really you're not a patient yet. Why this matters, besides health, obviously, is we approach $3 trillion what we're spending, which is an extraordinary sum of money for healthcare in the US. And in fact, if you could reduce that $3 trillion bill by even 5%, you'd save $112 billion a year. By 25%, over $500 billion. And then the message there is that actually, as I've said, the data collection has become easy for us. And this is what we do well. The making sense of it is what's hard. We have 80 million people with heart disease in the US, almost 1 million deaths a year, $500 billion in direct and indirect costs. The cost of prediction is obviously significantly less, $35 for a cholesterol test, for instance, than the cost of, say, a catheterization at $25,000 or a bypass at $85,000. Thank you very much.